Hello, my name is Riley Easter. I am an Aspen University nursing student, and this is my module for assignment for pharmacology. In this video, I will discuss a scenario of a patient and the different treatment options that we can provide to her, and I will also be discussing the need for mental illness awareness and why insurance companies aren't doing that. So, this week, us students are given a scenario of a 54-year-old woman who a jogger called into 911 about in a park that she was at. The woman suffered abrasions to her arm and face, and when she arrived at the emergency department, she was disorientated, combative, and was also experiencing tremors in her hands. Upon first impressions of the woman, I would assume that she is suffering from symptoms of alcohol withdrawal. Signs and symptoms of alcohol withdrawal can include anxiety, irritability, shakiness, tremors of the hands and other body parts, delirium, nausea, and vomiting, as well as disorientation. These signs and symptoms vary between individuals based on the amount and frequency of alcohol that they take on a daily basis. And based on her symptoms, I can logically assume that she is suffering from alcohol withdrawal. Short-term and long-term effects. Based on the assumption that the patient is suffering from alcohol withdrawals, there are many short-term and long-term effects that she could suffer from. Short-term effects that she can suffer from can include drowsiness, headaches, impaired judgment, blackouts, distorted vision and hearing, and unconsciousness. Long-term effects that she can suffer from can include alcohol poisoning, high blood pressure, stroke, other heart-related diseases, liver disease, liver failure, nerve damage, permanent brain damage, ulcers, gastritis, and cancer of the mouth and throat. The severity of these symptoms vary individually and depend on the frequency and amount of alcohol consumption on a daily basis. The causes of the medical condition. For the patient in the scenario, it is stated that she is suffering from tremors of the hands. The tremors can be attributed to the fact that alcohol is a depressant for the central nervous system, and since she is showing symptoms of withdrawal, that means her nervous system is no longer being depressed by the alcohol. This means that her nervous system is experiencing a hyperactivity, which is causing the tremors. The patient is also feeling ill due to the withdrawal symptoms, and this can be attributed to why she is experiencing disorientation and combativeness. Since we don't know the extent of her sobriety or her condition, she could possibly still be intoxicated, making her symptoms more severe. Assessment needs for patients. Assessments that would be important are cognitive assessments, an assessment of her emotional status, and it would also be important to run a toxicology report to ensure that the patient is not on any other substances and that we know what she was taking. It would also be pertinent to find out the patient's medical history, if she has suffered from any other mental illnesses or mental health in the past, or drug abuse, and if she is taking any prescription medications, or if she is refusing to take any prescription medications that she may have. It would also be important to know if she has any allergies, such as allergies to medications that we might give to her. And it is also important to know how much and how frequently she is using alcohol on a daily basis. For mental illness is what affects many individuals in the United States on a daily basis. It is important to encourage patients to be vocal about how they are feeling with their healthcare providers, and it is also important that they see a specific healthcare provider consistently in order to keep a record of their response to treatment and how long they are doing treatment for their mental illness. When it comes to treatment of mental health and mental illness, there are multiple different options. The two most common are pharmacological and therapeutic. So therapy, different medications that can be used as a pharmacological treatment for treating different mental health disorders can be fluoxetine, diazepam, and methadone. And also therapeutic options are things such as seeking therapy, like seeing a psychologist or psychiatrist, or even going to things such as group therapy or one-on-one therapy with a different type of therapist that they might prefer. The issue with insurance and mental health is that insurance doesn't really cover mental health, making it less affordable and less accessible to people who do suffer from mental health. With the passing of the Affordable Care Act, however, it made it to where most individuals of group health and individual small health plans to have coverage when it comes to mental health and substance abuse disorder services, making it more accessible and more affordable. Still, the common issue with mental health and seeking treatment is that patients face a large out-of-pocket expense if they do not have coverage, which means that treatment is not affordable or accessible to them. In order to help mental health patients, it is important to create more affordable and accessible ways for them to seek treatment. It is also important to advocate with insurance companies to show that mental health and mental illness is important as physical illness and that they are on the same level and should be covered the same. As healthcare providers, it is very important that we treat the person as a whole, which means that mental health and physical health should be on an equal playing field when it comes to coverage and treatment of those, as well as the treatment of substance abuse disorders. Thank you.